That's a great question. So I think the study is important for a couple of reasons. The first is that over the past 2 decades, we have made such huge strides in the molecular characterization of AML. I can tell you, even when I was in training, we didn't know as much about AML as we do now in terms of its biological heterogeneity. And so now we're able to more accurately characterize the disease on a molecular level, and that's allowed us to refine the way that we prognosticate for these patients. And so one question that we had was whether or not these advances in AML have actually led to improved outcomes or not. And what we saw was that for AML patients as a whole, the survival has improved. However, it has not improved as much for younger Black patients. And so younger Black patients have not benefited as much from these advances that we have in molecular characterization of AML. So I think it was important to look at that issue. Additionally, the second reason it was important to undertake the study was that we were not aware of any large study that actually looked at genetic aberrations in leukemia cells that were racially based. And so we looked at that and were able to actually show that there were some pretty important gene mutation differences between Black and white AML patients. And we hope that that sparks sparks future conversations and ideas for research. And so as far as past research looking at survival disparities in AML, I can tell you that we're definitely not the first group to look at these survival disparities. Other groups have definitely reported that that Black patients have worse survival than white patients. And a lot of those reasons have been attributed to potentially treatment or to social or socioeconomic factors. But this was really the first study that actually asked the question as to whether or not there were biological differences in the actual leukemia in these patients that could potentially contribute to or account for these survival disparities as well.